Okay, we are going to demonstrate how to change the dressing on a peritoneal dialysis catheter. Of course, washing your hands and applying clean gloves before. So just remove the old dressing. Observe for any signs and symptoms of infection. This one has a little bit of crusting after surgery, which is normal, so we don't want to try to remove that. You just let it fall off naturally, otherwise it'll cause bleeding. The tunnel, which is where the catheter goes under the skin, should not be tender or sore. So then we are going to clean it with saline and gauze right now. At home, the patient can use antibacterial soap and water. So always start right where the catheter comes out of this patient's skin. When I use saline, I just blot it a little bit and gently clean it. And if you want to go around, then after you can, but never go back towards the exit site. And make sure that that dries really good. We'll be applying mupirocin to that site. So we got the antibiotic cream. At home they use ointment, so don't be surprised if the patient thinks it's different. And we just put a pea-size amount on the cotton tip applicators. And just gently apply that, and you can try to get underneath the catheter a little bit too. And then we take a 2x2, we fold 1/2 of it and tuck it underneath the catheter, and then form the other one just for a little square. It's always important to anchor this side of the catheter really well so it doesn't get tugged on accidentally. The tape gets really hard to rip. Okay, back to the show. Here we go. So secure it down there, and if it does get tugged on, it's gonna pull on the tape in the catheter instead of directly to the site. And then 4 pieces of the large tape. A lot of our patients use Mefix or Medipore. And make sure that you don't kink the catheter like that, otherwise it could cause it to develop a hole in it. If anything does ever happen to the catheter, you want to clamp it as close to the body as possible, and do not do their treatment. And call the nephrologist and tape it to the abdomen securely. And that is a PD dressing change.